Today, we will be covering the recent American Thoracic Society Guideline for Systemic Sclerosis-Associated Interstitial Lung Disease. This guideline was published September 2023 in the American Journal of Respiratory and Critical Care Medicine. The International Expert Guideline Committee was comprised of 24 individuals with expertise in rheumatology, systemic sclerosis, pulmonology, and interstitial lung diseases. The guideline was developed using the Grading of Recommendations Assessment Development and Evaluation Evidence to Decision Framework, also known as GRADE for short. This framework categorizes recommendations by the strength of the recommendation, strong and conditional, as well as the certainty of evidence, high, moderate, low, and very low. The framework also allows for the inclusion of ungraded best practice statements. Throughout the video, we will be using the following abbreviations to keep things simple: ILD for interstitial lung disease, SSC for systemic sclerosis, and SSC-ILD when referring to systemic sclerosis-associated interstitial lung diseases. Interstitial lung disease is a significant cause of morbidity and mortality in patients with systemic sclerosis. ILD has emerged as the leading cause of systemic sclerosis-related death, contributing to 35% of such deaths. And as such, optimal treatment recommendations for the care of patients with SSC-ILD is imperative. The standard of care for patients with SSC includes lifestyle modification, measures to minimize risks for overt and/or occult microaspiration, with or without treatment with proton pump inhibitors, H2 blockers, and/or prokinetic agents. Associated manifestations of SSC not addressed in this guideline include pulmonary hypertension, esophageal dysmotility, and GERD. For the purposes of this guideline, ATS define the patient population as having SSC-ILD if both SSC and ILD are present. SSC is defined using the former American Rheumatology Association 1980 criteria or the 2013 American College of Rheumatology and European Alliance of Associations for Rheumatology classification criteria. ILD is defined as the radiologic presence of reticulation, traction bronchiectasis, traction bronchiolectasis, honeycomb cysts, ground glass opacities, airspace consolidation, other interstitial lung abnormalities, or any of the recognized patterns of interstitial pneumonias reported in the context of SSC. So with that background in place, we can get into the recommendations. ATS makes a single strong recommendation in this guideline. ATS recommends mycophenolate to treat patients with SSC-ILD. Again, this is a strong recommendation with a very low quality of evidence. ATS also makes 5 conditional recommendations. ATS suggests the following medications to treat patients with SSC-ILD. Cyclophosphamide with a low quality of evidence. Rituximab with a very low quality of evidence. Tocilizumab with a very low quality of evidence. Nintedanib with a very low quality of evidence. And nintedanib plus mycophenolate with a very low quality of evidence. Due to insufficient evidence, ATS was unable to make recommendations for the use of pirfenidone or pirfenidone plus mycophenolate, and instead recommended further research would be necessary. This is a very low quality of evidence. ATS also offers a single best practice statement. Caution must be taken in using systemic corticosteroids in patients with SSC, with or without SSC-ILD. Whenever possible, the daily dose should not exceed the equivalent of 15 milligrams of prednisone. The recommendations in this document represent the 2023 ATS Evidence-Based Clinical Practice Guideline for the treatment of patients with SSC-ILD. These are intended to serve as the basis for informed and shared decision-making by clinicians and patients. The guideline aims to serve as a starting point to highlight gaps in evidence and to encourage future research into topics and comparisons can then provide more prescriptive guidance. Further research is therefore needed to determine treatment, efficacy, safety, and the impact on patient quality of life by disease status to determine if there exists a differential treatment effect going from initial diagnosis of SSC-ILD to development of progressive SSC-ILD. Furthermore, additional studies looking at combination therapy and the sequence of initiating each therapy would be of clinical benefit. Thanks for tuning in to the Guideline Central recap of the 2023 American Thoracic Society Guidelines for Systemic Sclerosis-Associated Interstitial Lung Disease. For more information on this guideline, or to access the Clinical Practice Guideline Summary, Docket Guide, Patient Summary, as well as a number of other great resources such as clinical calculators, trials, and more, visit us online at GuidelineCentral.com or download the Guideline Central mobile app available on iOS and Android devices. We'll see you on the next one.